Alright, okay, so hello dears. Hello dears, Ayan, and welcome to the third video and hopefully the last video on our lecture on autoimmunity. And for this lecture, we're going now to start discussing the second systemic autoimmune disease that we're going to discuss, and that is your granulomatosis with polyangiitis. Alright. Now your granulomatosis with polyangiitis is also known as your Wegener's granulomatosis. I'm sure you've heard about this in your CM, AUBF, diba? Alright. And this is an autoimmune disease, of course, that involves inflammation of the small to medium-sized blood vessels or vasculitis. Okay. Now, it usually begins as a localized inflammation of the upper and lower respiratory tract. And some symptoms may include, again, non-specific, fever, myalgia, malaise, alright? And majority of the patients progress to develop a more systemic form of the disease that can affect everything, no? Can affect any organ system. Okay, alright. Etiology is still unknown, but again, multiple genes have been thought to be involved. Alright. And most patients with GPA or your granulomatosis with polyangiitis did a grade point average chart. GPA, alright, they have characteristic antibodies known as your antibodies to neutrophilic cytoplasmic antigens or your ANCAs, okay, ANCAs. Alright, and 80% of these, the antibody is directed against an enzyme and the azurophilic granules of your neutrophils called your PR3. Most of your Wegener's granulomatosis, okay, it's an ANCA against the enzyme found in the azurophilic granules of your neutrophil known as your PR3. Okay, that's the antibody that your patients with GPA have. Okay, alright. And serological findings: elevated CRP, again inflammation, elevated immunoglobulin levels, positive ANCAs following the C-ANCA pattern or cytoplasmic ANCA pattern. Again, we'll discuss that in the next slides. And possibly, of course, other autoantibodies and such as RF, rheumatoid factor, and anti-nuclear antibodies. Okay, alright. Ayan, so that's for the introduction for your GPA. Okay. Now, we go now to the characteristic antibodies that are found in patients with GPA, your anti-neutrophilic cytoplasmic antigens. So by the name itself, these are antibodies that are directed against the proteins that are present in the neutrophil granules, so in the cytoplasm or in the neutrophil granules. So these are antibodies that are attacking your neutrophils, alright, especially or specifically their granules. Alright. Now the patient's serum is screened for ANCAs using IIF pa rin, but this time we use ethanol-fixed leukocytes. Why? Because ethanol permeabilizes, meaning iyakang i-soften, iyakang i-let, no? Iyakang i-allow ang pagsulod sa o paggawas din or pagsulod sa mga reagents na need for the test, no? Iyakang ipasulod sa neutrophils. Okay? Alright. Muna yung purpose sa ethanol. So ethanol-fixed na leukocytes ang gamiton. Okay. Alright. Now, there are two patterns that we look into. That is first, again, the C-ANCA or cytoplasmic, which is again characteristic for GPA. And another is the P-ANCA or peripheral ANCA na pattern. Now, we start first with your C-ANCA. The pattern is described as diffuse, granular, staining in the cytoplasm of the neutrophils. And staining is most intense in the center of the cell between the nuclear lobes and gradually fades at the outer edges of the cytoplasm. Because again, it's focused on the cytoplasm, it's focused on the center, it's focused on the granules. So magkagawala siya pag padulo na sa outer. Okay. And in contrast, your peripheral is of course surrounding the lobes of the nucleus and blending them together so that individual lobes cannot be distinguished. So sa peripheral sa lobes, ang imuhang staining for peripheral ANCA. Okay, P-ANCA. Okay. Alright, now for P-ANCA, you can also, pwede siyang since IIF niya siya, especially for P-ANCA, you can mistaken it as a staining pattern for dsDNA, like homogeneous pa siya na staining. But always take note that we used here human leukocytes, ethanol-fixed leukocytes, and we're talking about neutrophilic granules. If the staining is really homogeneous, so pwede po ma-appeal ang other cells na na-added to, alright, like lymphocytes or whatever, okay? But for this test, Manggod, we're only talking about neutrophils. So to know that it's really P-ANCA, ang iyang stain ra gyud or ang na-stain ra gyud are the neutrophils. Your lymphocytes and other leukocytes will not be stained. Okay? Alright, that's how you distinguish. Okay? You can be, you can be mistaken. You can mistake, nalimutan ko sa grammar, teka lang. Pwede ka masayog na, Bisaya na lang lagi. Pwede ka masayog sa imuhang PANCA and be mistaken it as a homogeneous na IAF dito sa mga anti-nuclear antibodies. But again, to differentiate, if it's really PANCA, ang mas nainra is the neutrophils. And the rest of the cells that is found in the suspension, diba, kay leukocytes mo na gamiton. So, the other cells aside from neutrophils, dili mastain. Alright? But if it's homogeneous, silang tanan mastain. Okay? Kay anti-nuclear antibody man, ang sa homogeneous, diba? So, tanang nuclei of whatever cell. Diba? O yan. So, muna siya. Okay, alright. Ayan. And a positive ANCA test must be combined with clinical manifestations and histological findings. Because again, diba, your Wegener's granulomatosis involved mga lungs, your tissues. So, nandiyan yung histological findings. So, it must be partnered or coupled with your ANCA test to make an accurate diagnosis. Okay. Alright, and we go now to your patterns, diba? So, this is your C-ANCA. So, as you can see, this is a lymphocyte, wala siya na stain because again, we're looking at neutrophils. So as you can see, makita pa rin mga lobes, diba? 1, 2, 3, 1, 2, 3. And it's usually, meron siya kapalibot sa lobes, diba? Like, na-stain sa mga lobes, ayan, that you can see sa cytoplasm. Whereas for your peripheral, wala na kayo makita na lobes. So lang tanan na yung makita, diba? And the lymphocytes, again, are not stained because again, we're looking at neutrophil, diba? Na mga antibodies against the neutrophil. So of course, the antibodies, wala antibodies to the lymphocytes, so hindi siya ma-stain. So as you can see, the lobes cannot be distinguished, diba? And it's really like homogeneous and spread dun siya na na-stain. Okay? That's P-ANCA. Alright. And a summary again, for C-ANCA, PR3 antigen disease is Wegener's granulomatosis. For peripheral ANCA, it's more on the other polyangiitis, your microscopic polyangiitis and eosinophilic granulomatosis with polyangiitis or Churg-Strauss syndrome. Ayan. So, the other mga polyangiitis, because your Wegener's granulomatosis is a group na sila of diseases. It's a group of diseases which have the same mga symptoms, polyangiitis. Alright? Ayan. And again, still the same, we have antigens, autoantibodies that attack the antigens of the neutrophils. Alright? Neutrophil granules. Alright? So that's for your ANCAs, anti-neutrophilic cytoplasmic antibodies. Okay. Alright, so that's for ANCAs, for granulomatosis with polyangiitis. Okay, now we go now to a summary, alright, of all your autoimmune diseases, starting first with your systemic autoimmune disease. Again, for SLE, multiple organ, alright, butterfly rash, diba? And different autoantibodies, again, the very specific are your anti-dsDNA and anti-SM, diba? Yes. And for RA, again, we have discussed that anti-CCP, the diagnostic unit test, or diagnostic antibody for RA. For granulomatosis, again, ANCAs, but you can also detect RF or ANAs. Alright, that's for your systemic. Okay? Now we go now to your organ specific again. Ano lang, run through review. Kaya important kay mga autoantibodies na present in each disease. So we'll start first with your Addison's disease, adrenal glands. Autoantibodies, of course, antibody to adrenal glands. Next is autoimmune hemolytic anemia within itself. They target the RBCs. You have antibodies, autoantibodies against RBCs. Alright. Next, you have autoimmune hepatitis. It targets the liver by the name itself. But please take note sa antibody, smooth muscle antibodies. Please take note, ayan, smooth muscle antibodies. Okay. Alright. Next, you have autoimmune thrombocytopenic purpura by the name itself. Platelets, anti-platelet antibody. For celiac disease, please take note of the antibodies. Anti-transglutaminase and antibodies to deamidated gliadine peptide. So, mga involves digestion. Okay? Anti-transglutaminase and anti-deamidated gliadine peptides. Okay. Goodpasture syndrome. Ayan, again, I'm sure you have heard of that again in your AUBF. It is an antibody to the glomerular basement membrane. Ayan. Glomerular basement membrane or pwede rin pulmonary. That's why I recall kanang good pastures of Wegener's malibong juto ana. So, good pastures kasi kaya pare-pares mo silang ngalan or like they are based on a name. So for Wegener's, di ba kay ANCAs? For good pastures is usually ang ibutan sa sa strats kay anti-glomerular basement membrane. So it's an antibody against the glomerular membrane, basement membrane of the kidney. So basta kung kinsa na G, siya po ang anti-glomerular basement membrane. Ang una na G, kaya ang Wegener's na ba? Unahan siya G, Wegener's granulomatosis. The first letter na G, good pastures, siya ang anti-glomerular basement membrane. Ayan, for ANCAS. Yeah, that's how I remembered it. Okay? Alright, just a mnemonic, but if you have your own mnemonic, go lang po. Alright, good pasture syndrome, again, antibody to your glomerular basement membrane. Next, you have Graves and Hashimoto's, which are again autoimmune thyroid diseases. For Graves disease, again, yung antibody is your thyroid stimulating hormone receptor antibody. So yung i-target TSH na mo release at receptor sa TSH ng mga antibodies. Alright? And for Hashimoto's, quite the same with Graves, anti-thyroglobulin and anti-thyroid peroxidase. Alright? But ang difference lang, ang Graves ang naay antibodies to the TSH receptor. Okay? So, you already know sa mga lab results ana no mention na limot na po ko. But again, always take note that TSH receptor, so dili siya kabind sa TSH. So, dili ma-active yung thyroid, dili siya ka-produce ng mga thyroid hormones, di ba? Alright, that's for Graves' disease. Alright, next for multiple sclerosis, by the name itself, do not be confused with multiple myeloma and multiple sclerosis. Multiple myeloma is a malignant proliferation of your plasma cells. So, increase mo ang antibodies, alright? Benz-Jones protein. For multiple sclerosis, alright, it's targeting the myelin sheath, it's targeting the covering, the myelin sheath of your nerves, alright? And the protein, antibody to myelin basic protein. And again, di ba recall CSF testing in your EUBF, IgG albumin ratio, the myelin basic protein testing po, di ba? That's for multiple sclerosis. Alright. And next is your myasthenia gravis. Alright. It attacks your nerve muscle synapses. And the antibodies present is this one. Antibodies to acetylcholine receptor. So, meaning I think magluya yung muscles, dili mo ma-move ang muscles ninyo. Because again of, walay synapses, walay, nerve instruction. Okay? Walay mga electrical signals na mo-act on the muscles, right? Myasthenia gravis. Alright, okay. So please take out yung mga specific nila na antibodies. Okay. Alright. Next, we go down to the last table. You have pernicious anemia by the name itself. Stomach. It's either attacking your IF, intrinsic factor, or parietal cell antibody, which is found in your stomach. Diba? Again, in your AUBF pa rin, diba, gastric fluid analysis, iyahang basal output o basta zero, kaya wala din sa kaproduce of acid. Kaya because of, again, na antibody against the parietal cell and intrinsic factor. If I'm not mistaken. Yes, okay. Next, you have post-streptococcal glomerulonephritis. So the same. Strep antibodies cross-react with kidney tissues. Same with the rheumatic fever. Okay. Next is another autoimmune liver disease, primary biliary cirrhosis. But this time it's anti-mitochondrial antibodies. For your autoimmune hepatitis, it's anti-smooth muscle. Kani siya anti-mitochondrial. Please malibog po ko ano sa actually. Alright, so try to find a mnemonic if you can. Alright, wala ko yung mnemonic na na-advise. Wala ko yung mnemonic na nagama for that. Okay, sorry naman. Alright. Next, you have scleroderma, anti-nuclear antibodies pa rin, anti-centromere antibody, anti-ACL17. And then for Sjogren's, you have eyes and mouth. For Sjogren's syndrome, one of its symptoms talaga is the continuous dryness of your mouth and eyes. Alright, so magsigiguga. Alright, is this me? Charot. Magsigiguga yung mouth and eyes. That's known as serostomia. If I'm not mistaken, but serostomia, this is drying of the mouth. Okay, dryness of the mouth. And as you can see, the antibodies there, anti-salivary ka. Okay, so wala na yung produce na laway. Okay, alright. And anti-lacrimal gland antibodies. So meaning, dili nakakaluha. Okay, wala na yung tears na produce. That's why, dryness of the mouth and eyes. Ayan, so mag-uga. Ako, alam na this. Sjogren's syndrome. Okay. Is this me? Charot. Okay, and last is your type 1 DM. Of course, attacking the pancreas. The beta cells in the islets of Langerhans in your pancreas. And these are your antibodies: anti-insulin, islet cell antibodies, anti-IA2 and anti-IA2 beta 8, and anti-glutamic acid phosphatase GA. So all of them contributing to the decreased production of insulin and also sa absorb sa insulin sa cells in a way. Alright? So, muna siya yung mga autoimmune diseases. Again, for organ-specific, sa board exam usually, ang magawas lang kay mga antibodies, autoantibodies nila. Alright? But for systemic, kato na mention, IIF ito mga patterns, very, talaga, common sa boards. Alright? Okay. And that's the end of autoimmunity. Okay, so, medyo maraming chika naman, but I hope na-gets lang. Again, this is the first topic in our miscellaneous topics, miscellaneous serology. And for the next topic, we're talking now on the different serology of the other diseases, infectious diseases, from bacteria to parasite, to fungi, bacteria to fungi. So we'll discuss that in our next recorded lecture. Alright? So again, dears, I hope you understood. If you have any questions, feel free to chat again in our group chat or PM me. Alright? And I'll respond as soon as I can. And I'll see you in the next recorded lecture. Thank you so much for watching. Have a great day, dears, and keep safe.